Can you talk to us a little bit about this?
I'll talk about the PRP itself. PRP means platelet-rich plasma. How do we get that? You make your own plasma. We take a sample of your blood, we put it in a vial, and then we centrifuge it. So we want to separate the red blood cells, the white blood cells, and the plasma. Plasma will contain an increased concentration of the platelets, which contain a lot of growth hormones, a lot of anti-inflammatories, and
so like the nutrients and the good stuff from your blood.
And the signaling factors to get your body to come in and regenerate things that might not be working optimally, like hair follicle. Yeah. Especially for this one. For hair loss treatment, it can be done for female pattern hair loss, male pattern hair loss, and this one, the unfortunate thing is that it's not just a single treatment. That you if you think about it, the hair follicle's got to be woken up, then it's got to start forming a hair again. The hair's got to go through the skin if it closed it off or if it sealed it off, and then it's got to grow. So it takes a good year, I would say, to see the full effect of your treatment. It usually takes 3 to 6 treatments monthly, so every month for 3 to 6 months. Okay. And then to maintain it, a treatment every 6 months.
Right.
Unfortunately, not everybody's a candidate for hair loss therapy with PRP.
Okay, so who would be a good candidate?
So a good candidate is someone that still has hair that is thinning, but doesn't have a fully bald patch that is healed over.
Okay, so my dad, who has like 3 hairs on the top of his head,
unfortunately not.
Okay.
You need to still have when you look at the head, there still needs to be some follicles that are maybe dormant, or but if it's fully shiny, I like to say like shiny skin on a patch, unfortunately it's not gonna work. It can be done if you're planning on getting a hair transplant. They like to have the area where they're going to take the graft from. They like to have PRP treated in that area to make sure that the grafts are going to be very healthy, and then they like to continue with PRP injections after the transplant.
That sounds great. And how about we talk a little bit about PRP in other areas? You can treat PRP.
Yeah, PRP can be used for many things. We can use it around the eyes.
Yeah, I've seen really great results for brightening up the eye and thickening the skin.
It can be used in combination with Potenza for a facial, which really helps with the texture again, the getting a really nice uniform skin tone, and any kind of, it's a great anti-inflammatory, so any kind of inflammatory process in the skin and the face, it can help with that.
It's a great add-on.
Right. It has been used as a filler. It can give a little bit of a lift and kind of again get the trauma from the cannula and have PRP in there, which will enhance the production of collagen.
How about the fun stuff? What do we have to avoid and not do after?
So this one, it's really important to stay very hydrated before the treatment, so that the sample that we take is good, and we can your plasma is very effective. And again, it's the same thing, like avoiding alcohol. It's all about avoiding the bruising and the bleeding and the swelling. So avoiding alcohol, avoiding any NSAIDs. During the treatment, depending on what we do, if it's for hair therapy, the longer part of the treatment is numbing the scalp.
Right.
That takes a good 15 to 20 minutes to fully be numb, and then it's taking the blood sample, spinning it. It takes a good 45 minutes to an hour to do a full scalp, and quite well tolerated. The shortest part is the injection itself.
And how does the injection feel when it comes to either the scalp or the face? Or?
It's almost like feeling like when it's well numbed, it's like someone pulling at your hair.
Okay.
That's how I would describe it when I got it done on my head. At times there's certain spots on the scalp that will be a little more painful than others.
Oh, you got yours done?
I did.
Nice. I wouldn't have noticed because you have a lot of nice hair, so clearly it works.
I've been thinning, and now I'm not thinning as much.
There we go.
Yeah, so it can be a bit painful, but it's super quick. So it's I'm a wimp and I go through it. So
okay.
Yeah.
So can't be that bad.
After the treatment, avoiding again anti-inflammatories. Arrive with a clean head because you won't be able to use shampoo that night.
Okay.
So shampoo the following morning. Okay. You can use water, just running water, to get the, to not have that oily hair on your pillow. But shampoo would be the next morning. No styling products. And making sure you eat before the treatment, after the treatment, and drinking plenty of water.
And that's like with anything. Eating a good meal before really helps to for your body to tolerate the pain.